For a lot of folks, we're coming to the point in this tremendous time of crisis and disaster of, you know, letting out some air. The adrenaline has diminished, and now the reality sets in, and we've been bombarded with images of such sadness and chaos over the last few days. We thought we'd check in with a clinical psychologist who, you know, maybe give us some comfort and some words of advice. Lynn Luncford from the University of Phoenix is with us. Thank you so much.
Oh, thank you for having me.
What can you offer? I mean, do we have reason to feel bad and depressed? I mean, understanding it's not a clinical condition, but a circumstantial situation?
Right, and I think one of the most important things to remember is that different people are going to react differently. So some people may feel depressed and sad, others may feel angry. Most of us are going to have difficulty concentrating, so where we could multitask very easily, now it seems like we get distracted easily and have difficulty focusing on what we're doing. All of those reactions are normal and expected after an event like this, whether you evacuated or not. Simply being in San Diego this week could have had that effect on people.
Yeah.
Is it normal for us just to kind of take a break from reality? We've talked about how slowly our programming is changing a little bit more, and I guess that is the reality of the whole situation. You do have to kind of step away from it, take a deep breath. What can we do to tell our neighbors how we deal with this whole situation?
Well, it's true, and we were talking before. It's a nice analogy of what people need to do. People need to get back to a normal routine because we've been, most of us, not at work. We've been glued to the television set 24 hours a day, sleeping a little bit and then getting up and watching some more. As much as we can, even people who are still displaced, if you could establish some kind of routine that helps you feel a little bit more grounded, a little more settled, and simply less anxious and less disconnected.
You know, Dr. Luncford, it may sound a little weird, but as I was watching Brooke Landau do her traffic report a moment ago, it was actually comforting to see the traffic going up and down 15 like a normal Friday evening. And is that bizarre? I thought that looks so good, that normalcy.
It's true. We feel comforted by what we know and by what is routine and by what's expected. It's that absence of routine that can throw us off so much. And this past week, certainly, the unknown has kept us out of our normal routine tremendously.
We've talked about this before. In case you missed it, I think it's so very important to talk about the children who have been watching the images along with us and how we deal with the kids, what we can tell them to reassure them that everything's going to be okay.
Kids are going to have different symptoms. Kids do what we call somaticize. They're going to have physical symptoms. So they're going to have stomach aches, nightmares, headaches. They have a difficulty putting into words what it is they're feeling, and they may feel guilt about some of what they're feeling. They may feel happy that their house didn't burn while the neighbors did, and then they're going to feel guilty that they feel that happiness. So they have very complex emotions as well, and they're bombarded as much as we are, because sometimes we're not even aware that they're in the room while the news is on. And they're so full of emotions and don't really have the language and the dialogue to talk about it easily. Doing things with our kids is how we help them talk. Play therapy with kids is simply a vehicle of where we play together so that they have something to distract them and allow them to just verbalize whatever is on their mind. So doing things with your kids, having activities, going bike riding, going for a walk if you can, walking the dog, those things will give you time with your children, and then they can start to express what they're feeling.
Yeah.
Answer those
Don't keep it in there.
Yes.
Well, Dr. Lynn Luncford from the University of Phoenix, thank you so much for giving us a little comfort and a little counseling session. I like that.
A little breath of fresh air. We all need to take a deep breath.
Thank you.
Thank you, doctor. All right, let's